title and protocol. Title is different from topic. How to make a title out of it. Okay. So like Dr. Surendra has said, we have now the tag or the keywords. What are these mesh terms that you will come to know as we go on in the day. And you have your template or pilot paper, which is your second guide. So you need to now write the title. So if you try and find out how to write a title, if you read books, if you ask guides, they will tell you what is written on the left hand side. It should be brief, it should be precise, it should be clearer, there should be no abstract terms, research questions should be clearly brought out. But you know, all this is very good, but you don't understand any of it. What does it mean? Really, what is he trying to say? So look at the two titles on the right hand side. See the first title, Study of 50 Cases of High Flex TKF. That's a very bad title. Because the study, if you say like that, it is too broad. You are not specifying what you want to study. Do you want to study the functional result? Do you want to study the longevity of the processes? Do you want to study the surgical technique? So you don't specify what you're studying. There is no comparative group. So the strength of the study becomes weak. So that's a really bad way to write your title. So the next title, the real way to write the title is a prospective comparison of high flex and standard TPR. Does the functional outcome differ? Now we just see exactly what you need to have in your title. So the title should include these exact points. It should point to the study design, the study population, the outcome measure, and your hypothesis. What is the study design? Again, this will come later, but you know, is it a prospective, is it comparative, is it retrospective, is it a randomized control trial? What is your design? What is your population? Which patients you are dealing with? So you are dealing with TKR patients. Some are getting high flex, some are getting. What is your measure? What are you actually measuring? So you are measuring is it a clinical outcome, is it radiological, is it a laboratory experiment outcome? So that has to come. And what is your hypothesis? What are you wanting to prove? So these 4 points should come out in your title. So we go back to our title. A prospective comparison of high flex and standard TKR. Does the functional outcome differ? Are these 4 points coming out in this title? So let's see. That is the study design. It is a prospective comparison. It is not retrospective, it is not cohort, it is not, it's a prospective comparison. That is your study design. That is your study population. The high flex ends. So there are some patients getting high flex knee, there are some patients getting standard knee. That becomes your study population. That is your outcome measure. So we are not dealing with the survival of the processes, how many years it is going to last. We are dealing with the functional outcome. How the patient is going to function, how his knee is going to bend, how much his pain relief is going to be, how fast he is going to walk, etc. etc. So we are dealing with the function. So that is the outcome measure. And this is the hypothesis. We are saying that the hypothesis is not a question. You can make it into a question to make your title more effective. The hypothesis would be that high flex knee gives better functional outcome than standard total knee replacement. That would be your hypothesis. You have to prove or disprove your hypothesis. Either it gives a better result or it doesn't. But you can make the hypothesis a question to put it in the title for impact. Okay, so that's how you write a title. Is it clear now that what things need to be there? When you know the things that need to be there in your title, it becomes easy to write a good title. And then, because your keywords are there in the title, you can keep going back to your title to write your introduction, to write your review of literature, to write your results, to write your discussion, because it all is centering around those keywords. So you've got a good topic and you've got a title. What do you do next? You need to write a protocol. What is a protocol? We'll get into that. It has to be submitted in 3 months. The first thing you do when you join your residency, you make a thesis protocol and you submit it to the examining authority. They will, once it has been accepted by them, then you can go ahead and do your thesis. So these are the parts of a protocol. Is the title, the introduction, review, aims and objectives, material methods, a list of references, and your pro forma. Okay? Your eventual thesis may have a similar but not necessarily same introduction, review. Everything will change because that's a much more detailed. Protocol is just, you don't have any results in your hand, you don't have any. Protocol is just what you plan to do. So it is not that the introduction will be the same in the original thesis. The introduction of your protocol will be different because you will be in a much better position to write a much better introduction in your actual thesis. Just touch on these topics. So introduction has to be again on your keywords. Okay, we'll just see how it goes to that. So keyword pick here. The introduction is to start with the broad. So we are discussing total knee replacement. So what is total knee replacement? What happens? Why it is done? What kind of result it gives? Then you say functional outcome. So does the patient knee bend well after total knee replacement? So this is how your introduction you have to write. You have to first write about total knee, then you have to write about what functional outcome total knee gives. Then you have to write that the standard total knee was developed in so many years back and it gave so much life and it gave a functional result, say 100 degrees of knee range of motion. And then you say that was not enough. For 100 degrees you cannot sit cross-legged, you cannot sit on the ground. So there is a need for a high flex design. And that high flex will give you more, 130, 140 degrees range of motion. So that's how you come down to your eventual topic. So from broad in the introduction, you start narrowing down to why you have chosen this particular topic, and in the introduction you have to use a lot of reference articles. Means you have to cite references. Now review of literature. Dr. Ashok is going to deal with the review of literature in a fair amount of detail. So we will not spend much time on this, but it is part of your protocol. You have to review the literature in the context of your, again the keywords will help you in reviewing the literature. Aims and objectives, materials and method, you will have to mention your study design, the sample size, your sampling technique, your inclusion exclusion criteria, data collection technique and tools, your data analysis statistical test. All that you have to explain in your materials and methods, how you plan to. Again, to your rescue will come your template paper because they will have material and methods, and you will find that your material methods will be more or less similar to this. Again, there's a whole lecture on aims and objectives, materials and methods. Now pro forma is the actual form, what you will fill when you take the patient's data. So patient in front of you, you will take a data model, you will fill that pro forma. So you have to make a pro forma. How to make a pro forma? Do a pilot study. Take a few post-op knee replacement patients, around 5 or 6, and assess them. Then you will realize that, okay, to assess them I need demographic data, name, age, sex, address, etc. etc. I need the clinical data. So is there a score? Oh yeah, okay, there is a knee society score. I need a knee society. I have to fill that knee society score. So I need a score. So then in your pilot study you will realize, okay, this is all the things that I have to include in my pro forma. After you do that, you finalize your pro forma and then you are set to collect the data. Once your protocol is ready, you have to submit your protocol for approval. Your guide has to approve it. Generally, most institutes will have a thesis committee, which will be all the professors who will sit and you will have to present your protocol, and they will help you to plug your loopholes, give you advice, okay, your title needs this change, your materials and methods needs this change, your aims and objectives needs this change, like that. And you need an ethics committee approval, because that is essential, that the ethics committee has to say that, okay, you can go ahead with that study. Once you have all these approvals, then you have a signature and you can submit it to the examination board, who will then again approve it. So the review of the protocol will be done by the departmental faculty, generally by a presentation. There will be a healthy debate, not every time it is healthy, but we hope that it will be healthy, and they will help you to plug loopholes. So now you have a good thesis topic, you have a submitted approved protocol, and now you are all set to collect your data. And by 20, I welcome Dr. Gautam Shetty to come here and talk about data collection. Just any more questions on title and protocol before Gautam starts? Any questions on, yeah?
So about the title which you mentioned, is it feasible to write in a thesis? Because that sounded like a literature title.
Fixation of the anterior column fracture. You have to reduce any